everyone, how you guys doing? Welcome to our show today. I want to welcome you all. Just make sure that you have subscribed if you've not, and share the video with everyone that is within your network. And also click on the notification bell, leave us a comment, give us a thumbs up, do all that so that whenever we come live, you guys will get to know. Okay, today we're talking about an issue that it looks like a lot of people are beginning to take for granted. Yes, the coronavirus. There are so many things. um, People say, oh, it's not happening, it's not real. Show me somebody that you know. In fact, that people say, don't mind all these Oyibo people. Show me somebody that you know that has suffered from this coronavirus. Some people will even say it's something that God sent to punish people. It's only with people who are ministers, people who are, all those kind of things. And then when you say, no, this thing doesn't have any bound, it can happen to anybody, or even doctors say, beg, go and sit down. Doctor, what? Doctor, it cannot happen to a doctor now. It's not possible. Doctors don't get sick now. No, 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 no. I'm so happy with our guest today because education makes you educated. That's all I can say. He has accepted to be on the show today because he is so interested, like the good doctor he is, in enlightenment and awareness of our people, to make our people understand that this thing is real. Because if he himself, as you guys will get to see, can go through the experience that he went through, then any other person can go through that experience. And so I would like you guys to please um, help me in welcoming someone who is joining us all the way from. Okay, I won't let the cat out of the bag. So, ladies and gentlemen, please help me in welcoming Dr. Paul to our program today. Dr. Paul, you're welcome.
Yeah, thank you very much. Thank you very much.
Thank you so much for accepting to be on our program today. Dr. Paul, I just want to, for the benefit of those that are watching us, tell me who Dr. Paul is and what you do for a living.
Well, as you have said, thank you once more. I am Dr. Paul Chukwunonso Ude. I'm a Nigerian from the Southeast and a graduate of the ESUT College of Medicine in the Southeast, one of the Southeast states. And right now, what I do for a living is that I practice medicine as an emergency resident in one of the hospitals in the Middle East.
Okay. So you work in emergency units.
Yes.
And I'll just go straight to the point. You had a in fact it still shocks me when I want to describe it, but you had a very, very, very close encounter with this coronavirus thing. Tell us what that encounter is like. First of all, describe for us the situation in the emergency department where you work as it regards coronavirus. What has been your experience? What kind of patients have you seen while you're there? Just paint a picture of your experience with coronavirus, especially in your emergency department.
Thank you very much. Well, as an emergency resident doctor, what we do is that we see every kind of patient in the emergency unit. When I say every kind of patient, I mean any type of illness, whether accident, whether febrile conditions, any type of emergency.
Yeah.
We see them in the emergency unit, yes.
Okay.
And now when we have this pandemic,
yeah,
70% of the patients we see probably come down with the condition.
Okay.
So we see them mostly in the emergency unit.
Okay. What has been the most scary case that you have encountered? The one that really scared you most?
Well, in the emergency unit, as I said earlier, you see all kind of cases, and some may be so devastating that you'll be so confused on what to do.
Yeah.
I may not actually pinpoint one that you may say that is most scaring, because sometimes you will see an
Yeah.
accident case that may come to the emergency room with the person bleeding to death.
Yeah.
That in before you, the person is bleeding from the neck. There is a vessel in the neck called the carotid artery,
Mm.
and you will see bleeding, profuse bleeding from the neck. You will be so confused on what to do, and before you, the patient might just, you know, die from there. So those kind of profuse bleedings are quite shocking and very intense when you see them.
Okay. So, having seen this kind of situation with this COVID case, tell us your own experience with the coronavirus. Your own personal experience with the coronavirus.
Well, thank you. The world has been devastated by this particular pandemic caused by COVID-19. And where I work, it is not different from every other place in the world. What I mean is the incidence of this coronavirus is enormous. And the center where I work as an emergency resident doctor, the incidence is also quite high, because initially the center wasn't a COVID-19 center, but because of the incidence rate getting enormous, the center was converted, a part of it was converted to be a COVID center. And it has not been easy. You may say that every day as an emergency resident doctor, you may be meeting at least 20 within the hours of your duty, 20 COVID patients, probably suspected because they come with the symptoms and before the test, and eventually after the test, they may come down to be positive. So you may meet at least 20 of these suspected cases in your shift, and it's not something that is funny at all. Most times you have direct contact with them, even though we are always protected with our protective equipment, but that just protects at a particular percentage, not completely 100% protective. So it has not been very easy with us, the doctors, at all. Then coming down to my own case in particular, as an emergency resident doctor, as I see these patients, you don't know who is positive. I call them suspected because they have not been tested, and you have contact with them. Occasionally or sometimes I have had these flu-like illnesses. They come and, after a while, they disappear. But sometime in June, I came back from work, and after some hours, I had some chills, and I thought it was the same normal flu-like conditions. I started having nasal congestion, some kind of feeling feverish, headache. But this time around, it wasn't the same with the ones I used to have it. I still believed that they were going to go, the symptoms will go as others. So all I did was to take the usual anti-cold medications. But unfortunately, the illness continued. And a day, 2 days, 3 days, there was no remission. I wasn't getting better. And again, I have these two flatmates where we stay together, doctors to my colleagues. On the third day, two of them, almost at the same time, started having the same symptoms like me. So it actually raised our suspicion to COVID-19. Then we had to go and test ourselves. And when we got to the hospital, we were tested after some amount of initial investigations. Unfortunately, 3 of us came out positive, 3 of us. But mine has gotten a little more complicated at that 4th day, because the initial treatment for COVID, though a controversy in the world now, wasn't commenced early on me. But when some investigations were done, like chest X-ray was done, the chest X-ray wasn't too good. So that is on me. It was followed up by a CT scan, chest CT scan. And when the chest CT scan was done, there was some evidence of pulmonary interstitial inflammations. That is, I had pneumonia then. And the reason being that I didn't commence that initial COVID medications early until the 4th day. Because in comparison with my flatmates, that they had started just that same day we went for the test. When they commenced it, none of them, the symptoms didn't progress, but mine progressed because I didn't commence it early. I was actually admitted into the hospital, but the other 2 were not admitted.
Dr.
So
Paul, hold on. Hold on, Dr. Paul. I want to show this video that you had sent to me. This is the video that you had sent to me.
Yeah, that was when I was admitted, yes.
Okay.
Yes, on the 4th day, I was taken into the ward for admission.
Okay.
After the chest, yes, after the CT scan came out and signs of pneumonia were there.
Okay, good. So go ahead, continue.
So when I was admitted, instantly the medications were commenced, and the medications I'm talking about is a medication that has been approved by the Ministry of Health in the country where I work, and there are a triad of medications: hydroxychloroquine, azithromycin, and zinc tablets. They were all commenced immediately.
Wow.
And,
Doctor, I need you to please slowly, but this is a very, very interesting thing you said right now. You said that treatment was commenced on you. Please, could you repeat that part again? It's a part that I would like to hear.
Sorry, which part?
Huh?
Sorry, which part do I repeat again?
Yeah. You said you commenced treatment with some drugs. Could you mention those drugs?
Yes. Initially, the first 3 days, I was taking anti-cold medications, not anti-COVID, But on the 4th day, when I was admitted, I was given some medications immediately. And these medications are triads of hydroxychloroquine, azithromycin, and zinc tablets.
Okay.
The 3 of them given. There are other ones that were given because of the complexity of my illness, because the chest was already severely infected.
Wow.
So there were some, yeah, there were some intravenous medications I was given also.
Yeah.
You understand? Like there is a drug we call a tazocine. Tazocine is also a drug, an intravenous drug that helps in clearing the chest of infections.
Yeah.
So these are what were done at that time, coupled with all the daily vital signs. In fact, let me tell you, for the 6 days I was on admission, my temperature was always high, 39.40 degrees Celsius, always. So, but when these medications were commenced, there were some remissions, and the infections were getting better.
Wow. See, I every time, of course, I've heard you tell this story before, and every time I hear you say this story again, it's scary to me because it brings it home. This is somebody that I know. I know you very well, and it just brought it closer home that it actually happened to somebody that I know. Now, tell me, you just described some of the things that you were feeling. Help me understand a little bit more. I have suffered malaria before. A lot of people will want to know what did it feel like? What did it feel like? Like the taste, the fever. Was it were you shivering? Were you weak? What were you? Tell me. What did it feel like?
Well, I believe, because of social media, everybody must have been conversant with the symptoms of the COVID-19. Some of these symptoms are interwoven with some illnesses in the tropics, like especially malaria. We have raised temperature, that is fever. We have headache. We have catarrh, that is a nasal congestion. We have cough. We have sore throat. We have weakness, bone pains. In COVID now, you may want to different these things, these symptoms I just mentioned. Some of them are also in malaria, so they are interwoven. But there is this very slim line of difference, like in the loss of sense of taste and smell. And all these symptoms I had all during the illness, yes. In fact, my loss of sense of smell came on the third day. That was when I knew. That was when I knew that this wasn't anymore a simple flu. That this was something else. Because what I love eating, I had no appetite anymore because I could not taste anything anymore. I could not smell anything.
Wow.
So that may be a differentiating symptom from malaria, because malaria, you may not find that actually.
Yeah. Wow. Well, I know God allowed you to go through this so that when you are the one saying it, then some of us doubting Thomases will know that for sure. If it's a doctor that is, this is not just that you're reporting, but you are telling us your own experience. Now, what's your advice? First of all, let's start with remedies and practices we can adopt at home just to be able to prevent catching this disease. Yours, because you're an emergency doctor, and honestly, my brother, God bless you. God bless all of you who, even though you know that every day you're going into that place, it's a battleground. You know that you're going to confront people who have these illnesses, and you still wake up and you go. I really want to thank you on behalf of all of us. We appreciate the work that you do, putting yourself in the line of danger. God really bless all of you. But please talk to those
Thank
of
you so
us
much. Thank
who,
you.
who are at home what I know, just like you have said, social media has so many things that people put out there, but when you hear it from a doctor and from our own doctor that we know very well, we know you're not going to deceive us, so please advise us, what should we do, what measures should we
Well,
take?
I know many of us, there have been a lot of controversies in the net, in the world right now, whether political or not political. But to the best of my knowledge, what we can do at home is, I usually call them a triad of preventive medicine to COVID-19. And these triad are very simple. The first is hygiene, proper hygiene, and that is hand washing. That at home, wherever you are in your house, dust come into our houses, inside the inner rooms, everywhere. If you are at home, ensure proper hand washing, proper hygiene, so that whichever one that may be in your hand, you will not transfer it to your mouth or nose. You may not even give it to another person. That is one. And this proper hand hygiene and hand washing has also made us, this 2020 has eradicated something we call handshaking. You will see someone there is no more handshaking. It is also a method. Yeah, it is also a method of prevention. So that if the person has it, you will not contact it from the person. That is one. The second part is wearing of your mask. Wearing mask can never be overemphasized in the prevention of COVID-19. However, this mask has to be well fitted, not a loose mask. It has to be well fitted. Well, some researchers have gotten one of the best, that is N95.
Which
And
is that?
N95,
The one you're wearing, is that the N95?
No, this one is the one I wear at home.
Okay.
When I go for work, we always put on N95, fitted N95. But this particular one is home mask.
What's the correct way to wear this mask?
Well, the description is actually there. The upper part.
Can you show us? Can you show us? Yeah.
Yeah, the upper part has an elastic material, while the lower part hasn't.
Okay.
Yeah, there is a white colored part and a blue colored part.
Okay.
If you are to prevent yourself from getting it, the white part has to be in the inside and the blue part has to be outside.
Okay.
If you have it and you don't want to give to others, the blue part has to be inside and the white part outside.
Okay.
Yes. So because some people wear it however they want.
Yes,
there are reasons.
Just wear it. You see, that's why
There is a reason. Yeah, there is a reason for the color differentiation. So with the ridge, we call it the nose ridge, the upper part of the nose. That is where the elastic material part will change.
Okay.
Just this way, yes. So that is about the mask wearing. So as I was saying, the third triad of prevention is social distancing. Social distancing. There are a lot of marks, that is limits, 1.5 meters, 2 meters, and even as long as 6 meters from the other person. Try to avoid social gathering because within there, you don't know who has the COVID.
But Dr. Paul, the problem is that, especially within the African society, when we see each other, you go to somebody, you have not seen your brother for long, you have not seen your uncle, you have not seen an elder. When you run into them, you don't want to be disrespectful. They are coming to hug you. You don't want to say no. They are not wearing masks and they are talking, and you just out of respect, you hug them, you shake them. Is that really good or bad?
Well, in the African setting, there is this belief, even in the majority of our people in the African continent, most of them don't even believe in the COVID.
Yes.
And I usually term it as ignorance. That is ignorance. And in the example you just gave, to me, sometimes what I do is, even if it is mandatory or compulsory that I must shake your hand, I may shake you, and that hand will remain as in non-functional until I wash it. Yes. To give that respect, I shake you. But the hand will remain non-functional. It is something that I have imbibed, and I encourage people to also do it. The man may say, the elder may say that this boy is disrespectful. Respect him. Sometimes I hold my breath. In a gathering, and immediately I leave there, I release it, just not to, inhale a very bad air. So in that setting, you may do it, but taking some very important precautions. Yeah.
How about maybe having a small hand sanitizer in your pocket, so that if you know you're going to confront that kind of situation, like, do it before you. Will that help?
If your hand was clean before applying it, it can help, or it may help.
Okay.
Then after the action, you also need to wash those hands.
Okay.
Because hand sanitizers work on clean hands, not dirty hands. Please, let's take note of that.
So much. Explain that
Yes.
point now.
Let's take note of that. If your hands are dirty and you apply a hand sanitizer, it is more or less very ineffective.
Whoa.
Ineffective in the sense that, yes, because if those hands are dirty and you're applying a hand sanitizer, you are only coating the already dirty hands. But if they are clean and you are applying it, that is when it becomes protective. So it protects it, yes, from invading organisms, from invading infections. So we should take note of that.
You see, in Igbo, they will just say, Onyisi bo onyisi. A doctor is a doctor. You see all these things you're telling us now. We just take it for granted. We just be doing it the wrong way. Anyway, so talking about these preventive medicines, and when it comes to drugs, there are two issues I wanted us to talk about. But let's first of all talk about Dr. Stella in the US. She came up with this video, and she's been criticized so much. But you, without even knowing that we're going to discuss about this, you talked about the drugs that they gave you when you were in the hospital, and you are talking about this oxy. What's it called now?
Hydroxychloroquine, yes.
And all those things that Dr. Stella was talking about. So, what do you have to say about that Dr. Stella's video?
I think I have seen that video, in the net, that is on social media.
Yeah.
Her testimony about giving her patients those drugs. I may not actually, I wasn't there when she did it, but my own personal experience is what I am telling everybody that is listening.
Yes.
In fact, let me tell you one thing that is happening around in my center and in the country where I work. In the beginning, when the pandemic started, there were a lot of cases. There were a lot of admissions. Mm-hmm. There were a lot of complications from this COVID. Mm-hmm. before hydroxychloroquine was introduced by the Ministry of Health in the country.
Wow.
Now, let me tell you something that is happening. Where I work, when you come with certain symptoms that are related to COVID-19.
Yeah.
In fact, we have a department we call the fever clinic. In that fever clinic, that is where the suspected cases go to. There is a criteria we use, and this criteria has a score of 18. From 4 or and above, we start hydroxychloroquine.
Wow.
That is 4/18. That is, if you have fever, only fever is 3. Only fever. Then, if you have fever and probably sore throat or cough or loss of sense of smell or taste, we start hydroxychloroquine. Then collect sample. Then, whether you are positive afterwards or negative, hydroxychloroquine will be started. You come back in the third day. We assess your symptoms, whether it is regressing or progressing. If it is regressing, we ask you to go home and complete the dose, then self-isolate at home, assuming you are positive. But if it is progressing, we take you in to the hospital. The testimony I want to give you now is that since this method was introduced, that is giving hydroxychloroquine to everybody that is suspected of COVID, the incidence of hospital admissions have reduced drastically.
Wow.
The incidence of complications from COVID has reduced.
Wow.
Do you understand? So there is tremendous positive effect of hydroxychloroquine.
Awesome.
Since it was through the years.
I'm just going to leave it there. And I mean, you are a qualified doctor. You are working in a country where they take healthcare very, very seriously. And
very.
You have experienced this coronavirus pandemic. You've experienced the disease yourself. You experienced the illness. You've suffered it, and you, as a doctor, know what you were treated with, and you are a living testimony. You are now talking to us completely free of this virus. So, I mean, I wonder who people will want to believe. If they can't believe somebody like you, I don't know what else they want. Now, let me talk a little bit about Nigeria. And before you left the country, I want you to just quickly give us a small, in summary, a comparison between healthcare delivery in Nigeria. Should we even go into that, because it's like everybody already knows.
Please, let's not go there.
Let's not go there. I mean, because
let's not go there, please.
It's like I don't even know.
The difference is like from an end of an ocean to the other. Let's not go there at all. At all. Let me just give you an example.
Yes.
Let me just give you an instance.
Yes.
The center where I work. You remember in the beginning when I was narrating my story?
Yes.
I told you that a CT scan was used on me.
Yes.
After the chest X-ray wasn't very yes.
Yes.
This is actually a general hospital. Okay. A general hospital.
Yes.
Has a CT scan. Nigeria has about 30-something teaching hospitals. I graduated in Nigeria. At least I graduated in one and did my compulsory internship in another. And I have friends that have gone to, other teaching hospitals. I bet you half of these teaching hospitals don't have CT scan in Nigeria. So let's not go there at all. Let's not go there, please.
Recently, some doctors in a state, some doctors in Enugu State. Why do I keep running around? Some doctors in Enugu State, they protested, and there was a massive media, attack on them. That why are they complaining? The situation is not like that. It's politically motivated. As someone who actually practice in Enugu State, do you think that those doctors then didn't have any reason to be protesting?
Well, the agitations, the doctors, Nigerian doctors' agitation, especially that of Enugu State, where I schooled for at least 7 years. They are very, very, how will I put it? They are very, very justifiable. Very, very, because they are talking about personal protective equipment to protect themselves and even the patients, because sometimes a doctor may be infected. If you don't protect yourself, you infect an innocent patient that came to the hospital. So this is one of the things they're agitating for. They're agitating for a good working environment, that the government should put things in order in the hospital so that they can be more effective in helping the populace. They are agitating for also pay. They say that a worker has to get a reward for his or her work. I don't know if you get it. So these are the things they're agitating for, and all are justifiable.
Dr. Paul.
However, yes.
Sorry, when we talk about pay, I don't want to get very particular, because if I get so detailed now, a lot of people will attack you. Immediately you stop this program, you're going to get phone calls, and people will line up with all the problems they have in this world. So I'm going to be very, very wise in asking my question. But enlighten us. The pay of a Nigerian doctor. Let me pity Enugu State now. The pay of a average Nigerian doctor, and the pay. No, compare it. Who earns that kind of pay outside the country where doctors are taken care of? What kind of person doing what kind of work outside Nigeria gets the same amount of money that the doctor in Nigeria gets? And tell me, compare the hours that a doctor works outside. I don't know, you can choose any country, that a doctor works outside, and the hours that a doctor works inside Nigeria, and their pay. I want you to compare these things for us, using any country.
Yeah, you are really putting me in a very tight corner.
No, I'm not. I didn't call names. I don't want to say it is how much you earn.
But the fact remains that the truth has to be said.
Yes.
Who was that? There was this politician or this minister in Nigeria that made a comment. I don't think there is any country in the world that pays as low as Nigeria to medical practitioners. I don't think there is. Let me give you an example. Some of my colleagues, some doctors are running to Kenya because of pay. Doctors, you heard in the news the other day about 58 doctors left Nigeria to UK.
Yeah.
58 doctors. That was about 3 weeks ago. 58 doctors left Nigeria to UK. They are not leaving as in because Nigeria is paying well. They are leaving because the discrepancy is enormous. In fact, the ratio is about 1 to 10.
Wow.
1 to 10. The difference in the pay.
Let's call figures now. A doctor in Nigeria.
An average Nigerian doctor. I worked in Nigeria. I was earning 180,000, 200,000 monthly. 180,000 as a medical officer.
Wow.
Or a resident doctor.
Wow.
Yes. And equivalent of my level, a medical officer or a resident doctor in UK is earning about 2.5 million. 2.5 million monthly. That is the fact. You can fact check it. You can Google it. The same level, a resident doctor in Nigeria, the best the person can get is 250, while in UK is 2.5 million. That is a ratio of what? 1:10.
Yes, yes.
So that is the fact. So any Nigerian doctor that is living knows why he or she is living.
And I can't blame them. I can't blame I cannot blame them at all. Totally.
Let me tell you something. This person, this doctor, in comparison to the working hours, a Nigerian doctor works almost 12 hours daily, and the day he or she is on call is a 24 hours call, 24 hours from morning till the next morning. And that next morning, the doctor will still come to work. That you did a 24 hours call does not mean you will go home and sleep. You will still come to work the time you just finished 24 hours work, you will still be on duty.
So when did you sleep now?
It is quite, in fact, I don't know the word to use for it. And despite all this stress, all these things, no compensation at all. It's too bad.
It is very disheartening. Now you see why you will not blame anybody at all. You will not blame anybody at all for traveling, for grabbing any opportunity to travel outside. Because can you imagine?
You can't.
No, you can't too.
You can't at all.
Can't at all. My brother, I really, really appreciate your coming on the program. You have opened our eyes. I looked forward to this program because you have spoken from the heart. You have spoken the truth. You have not kept anything back. I'm going to round up by you also speaking directly to our people about what to do and what kind of treatment to embrace when they have these symptoms. Let's just use that as to round up the program. Just speak to our people once more.
Yeah, thank you very much. Our listeners, I appreciate your coming on board to listen to us. Well, the pandemic still continues, though some countries are still having some high incidence, while some are having low incidence now. But in all, I want to encourage us to imbibe and ensure that we continue those triads of preventive medicine for especially COVID and other infectious diseases. And these triads are hand washing and proper hygiene, mask wearing, face mask, tight fitted face mask wearing, and social distancing. And whenever you get any of those symptoms I mentioned, like you have fever, maybe chills, a high-grade fever that you have not experienced in recent time, you have cough, sore throat, nasal congestion. Maybe this nasal congestion, you haven't had it for a very long time, that comes with loss of taste, loss of smell. Please, if I were you, I will visit a hospital. But if you are very far from hospital, you can go to any pharmacy, get hydroxychloroquine. Hydroxychloroquine, though, there are some initial investigations you need to do, especially in the heart, to check if you can take it or something, it also helps. It helped me, helped my flatmates. And I believe it has been helping a lot of people with COVID in this country where I work. And I believe it can also help you. So stay safe, please. Thank you.
Thank you so much, Dr. Chukunon. So now, on a final note, I know you are very active, even though you are thousands of kilometers away from your roots, but you are very very active in activities that happen in your very hometown where you come from, and a lot of them are watching you right now. To show us that you're a son of the soil, I would like you to greet people back home. You are also one of the members of the Ozala Center for Disease Control, which was put up to help curtail those activities of COVID-19 when it was really really high. So I would like you to just greet our people back home so that they'll know that they have not lost you completely.
Yeah, ndị be anyị ndị be anyị na-ekene unu ndị isi Ozara Forum especially, that has brought us all together from within home, far and wide, and the tremendous egwuregwu egwu na amụ repackaged that is ongoing. I really appreciate you guys and ndị be anyị niile niile n'Ozara. Aka m bụkwa onye Ozara, typical onye Ozara, and anyị nchaka nọkọ ọnụ. I thank you all so much.
All right.
Thanks a lot. Yeah.
Thank you so much, Dr. Paul. Thank you so much. I thank you for coming to the program. Whenever we call you, please answer our call next time. All right.
Thank you so much. Thanks.
Take care of yourself.
Thank you very much. Thank you very much.
Bye bye. Yeah.
Thank you.
Okay, so that was Dr. Paul Chukunonsode, and he was our special guest today. We are so privileged to have him open up. A lot of people, out of stigma or ignorance, will not even accept to do this kind of program, but he graciously allowed us to interview him, and you saw him talking boldly. He's the kind of doctor. I know him, he's an activist, so that's why he's able to actually freely speak the way he spoke, and we are so grateful to him. We're going to end the program on this note. Please stay safe, my dear brothers and sisters. This thing is real, and until we have a solution to it, please continue to do your best and protect yourself and your family. From all of us here in the Toronto studios of Worship Media, on behalf of Dr. Erica and all our crew members from all over the world, this is Dr. Chidi saying, as always, I love you, and I'll see you guys very soon. Bye-bye.